Let's bring back Mayor John Tory for his weekly check-in here. Mayor Tory, that was interesting to hear from Dr. De Villa because she said this is the most concerned she's been during the pandemic, and that's got to say something because a lot of people are seeing numbers, and some people just see numbers and say, but wait, Ontario's case count looks okay. Why should we be so concerned? But you stand by Dr. De Villa.
I most certainly do. I've never seen anybody as professional and as unflappable as her. And so when she says she's concerned, I mean, she's not doing it in a kind of an emotional, wound up sort of way. She's doing it in a very professional way, as your doctor would tell you that he or she's concerned about your health. And so let's put those numbers, though, in perspective. I mean, the numbers that everybody is declaring victory on now and saying they're all so much better and so on, compared to the numbers we had at the end of the summer, are still way, way higher, first of all. So to me, that isn't a reason for a declaration of victory. But the second thing, and it really, really speaks as well to the question of the testing in schools that you made reference to, is that we've just reopened the schools. The schools are the one place where the variant has not entered because they were closed. And she is saying, and I am saying, supporting her, that we should be making sure those schools stay safe, that the variants stay out of the schools, and that we should get that right before we start opening up other things, because the worst thing that could happen is to get the schools, to come down with the variants and have a lot of COVID-19 into the schools, or to have another lockdown. So we open up and declare a victory, and then find that a month from today we have to lock down again. I think most people are given the choice of locking down again in a month, or taking a little more time now to do this carefully with great caution in light of the history of the variants everywhere else. They would take the caution. I believe they would.
We hear from a number of small business owners on a regular basis saying, listen, we've already been prepping for that potential February 22nd. Now what do we do? We're sort of sitting and waiting. When do you anticipate to hear word from the province?
Well, I think they've said it's going to be at the end of the week. And that's one of the reasons why we came out yesterday, Dr. De Villa and my supporting her, to say that we believe that Toronto should have some additional time. And the medical officer in Peel said the same thing. And our objective here is to make sure for those very same businesses who want to plan, and I understand that. I used to run a large business, and you need to plan. But for those very same businesses, what we're trying to do here is make sure what they don't face is a month from now being told, guess what, you have to close down again. Because I think they would say that that is worse than having a couple of weeks. Now, imagine with all the talk we've had and all the work we're doing to have these Cafe TO patios and to have all those kinds of things to help businesses get back on their feet in our good weather. At just that time, we're saying, well, terribly sorry, we didn't take adequate account of these variants, and we didn't sort of wait until things really were in the right shape to open, and I'm afraid we have to close again. How would everybody feel about that, including the people watching, but also the business people? And that's not even to mention the most important thing, which is the possible lives that could be taken and the strain on the healthcare system if we get this variant thing wrong. People forget what happened with the variants in Britain, where in a 1 month period between mid-November and mid-December, the number of cases doubled from, I think, 15,000 to 50,000. That's more than double, tripled. And the same thing has happened in other countries. In Newfoundland, a couple of weeks ago, they had no cases virtually at all. They'd had 700 during the entire pandemic, and then all of a sudden they had 300 cases because of the variant. This is the kind of thing that we're keeping our eye on, and I'm taking Dr. De Villa's advice because she's the doctor. I'm not, and I'm just trying to take the best advice we can get. I ask a million questions to make sure we're trying to do this right, but we're just trying to do the right thing.
Something that we're also watching, Mayor Tory, and the challenge has been our homeless population. We heard Frankie mention this. We've seen the cold temperatures. Yesterday, a fatal fire at an encampment. I believe it's the 27th encampment fire this year alone. It's a challenge dealing with mental health during this COVID pandemic and looking at what housing is available. Is there a solution to putting a stop to what we're seeing? And it's a dangerous trend with these encampment fires.
Well, they're a terrible tragedy. They're dangerous, as you say, but they're tragic, too. I mean, this is a human being. The first thing we are doing is we have a Streets to Homes team, as dedicated a group as you could ever find, that are out every single night. So the night before last, they met with 70 people who were in encampments and on the street and offered them to go inside. And 10 of them said yes, but 60 said no. But they're doing that every single night, and they, in fact, visited the encampment, which was the site of the fire, at 2 o'clock in the morning, before the fire broke out at around 6 o'clock in the morning. So they tried there, but having said that, it was a tragic outcome. The main thing we're doing, which is more important, is literally putting in place, with huge help from the federal government, I should say, hundreds of units of new supportive housing. So people who do have mental health issues or who have substance use issues will have a safe home to go to. And that's we've moved 3,000 people off the streets and out of the shelter system and into other kinds of housing during the pandemic. This is an incredible accomplishment, but there's still lots to be done. We're very much on top of this. And by the way, we could use some help from the provincial government to help with the operating costs of that supportive housing, because the support is the form of nurses and medical professionals and mental health people who can help support these people who have some very profound challenges in their lives. They're not bad people. They're people who have challenges and who have illnesses and who have substance use issues. And these are people we need to support, and we're trying our very best to do that.
Mayor Tory, as always, we appreciate you taking the time with us, and we'll see you again next week, Thursday. Thank you.
Thank you, Mel.
It is 7:11. That's your time right now. Devo Brown got your sports. Good morning, my friend.